Mention in your lectures. In your lectures. In your lectures. Hello, Nancy.
Yeah,
Nancy, can you hear me? Nancy, do you remember what we had last week? Yesterday.
yeah, about the research, primary and secondary.
Amazing. Amazing. Good. Good. A minute. So we did primary research and secondary research, isn't it? Isn't it? Daisy.
Yes, yeah.
Yes, yes.
Daisy, I've just joined. Daisy.
Hello.
Is it Daisy?
Yeah.
Good. Is that your first time of joining?
Yeah.
Good. Amazing. Have you had a chance to follow at the last previous lectures?
No.
Okay, that's fine. So, Daisy, we did research yesterday. We started off yesterday with research.
Yes.
Do you have access to your student model?
No.
Why? Why? Don't you have access to your student model?
No.
That's the first thing you're supposed to have.
How
That's
do I access?
you should have gotten an email from the office, the admin team, since when you were registered.
I didn't.
You need to go back to the back office on Monday, tomorrow, okay?
Okay.
All right. So we Nancy, if you can you help us with a recap of what we discussed yesterday? Or Prince.
Okay, sir. Please, basically, we did the primary and the secondary yesterday. And with the primary, we spoke about research, as in finding a problem and finding a solution. But with the secondary, you've already found the problem, solved half of it, or like almost 80% of it. So the secondary, you are almost done. It's easier than the primary.
Okay. Any any additions? Do you remember tertiary?
Yes, please. Tertiary is finalizing everything, getting
what
answers to or solutions to your research.
Okay, so what are some of the examples that were given for tertiary? Do you remember tertiary? What are some of the things that we mentioned with tertiary? Journals, you remember?
Yes, yes, I remember. Yeah.
Wikipedia, do you remember?
Yes, please. Yeah,
Good,
yes.
good, good.
Thank you. Yeah.
So, yes. So, Daisy, these are some of the things we discussed yesterday. What did I say
Oh,
in terms of the choosing of a topic? What did I say? What was my advice on the topic choosing of a topic? Choosing of a research topic. What was my guidance on that? Friends,
Yes, please.
what was my advice on choosing of a topic?
Oh, okay. You advised us that when we are choosing a topic, we should choose a topic we can talk well about, and any source of uh how do I put it? Like
Mhm.
any source we do our research from, when providing the research, we should involve them too. We should write to them, maybe I got this answers from this place, I got this from that place. Yeah.
Okay, good. So let's crack on. Identify and selecting appropriate source for research projects. Okay,
Okay, sir.
identify the right for a research project. Now we've done our primary research, we've able to do some secondary. And then we're looking into identifying and selecting the appropriate source for the project. It says to ensure a comprehensive and robust investigation into a socioeconomic disparities in healthcare access in the UK. It is essential to identify and select a range of high-quality sources from the relevant subject area. These sources will provide the necessary theoretical background, empirical evidences, and context for research projects. The type of sources. What are type of sources? They say academic sources. Academic sources. Then we can also have books and book chapters, government reports and statistics, non-government organization reports, theses and dissertations, conference papers, professional and practitioner journals, where research journals are more to do with tertiary kind of research gathering of information. Okay, so these are all conduits and mediums where you can gather information on data. All right, these are all. But then we can look into key sources and their relevance. Academic journals, the Lancet relevance example article. So, one, academic journals, what are the relevances? It publishes peer reviews. When I say, what do you understand by peer review? When we say peer, what do you understand by peer review? What do you understand by peer review?
Peer review.
Yes.
Okay, please. I want to try.
Say again, please.
I want to try.
Okay, give it a try.
Okay, like sorting solutions, or like showing your research to friends to find out whether like it's cool or not.
Repeat yourself again. Showing what?
Showing your research to your friends, or like sorting like the knowledge of people to see whether like what you've written or like what you've gathered is cool or not.
Yes, but it's has to do with your peers. Yes, but not to say good. Yeah, it's like your friends reviewing your research work. It's like a critiquing your it's a review. Okay, so it's a peer review. Your own colleagues
Okay.
You know, when you write a project work and all that, you can normally your supervisor may be the one to guide you or review what you've presented, isn't it? In choosing your topic. However, there are instances where your colleagues can review your project work or proposals or whatever. It's called peer review. If you write articles or research proposals, your peers can critique, what we call constructive critique, review and that's what we call peer review. So it's a published peer review research on public and health and social care, health and social determinants of health, useful for understanding broader health disparities. Nancy, are you there? Have not heard
Yes.
from you today. Are you there, Nancy?
Yes, I am.
Amazing, amazing, amazing. So let's look at example of the lancet is the Mammoth M 2025 Social Determinants of Health Inequalities, the lancet 365964. So it tells you, you realize that it codes the pages and everything, the page number and all that. That is academic journals. Mammoth M means that the writer's name is called Mammoth. And 2025 means that is the year of the book, or isn't it? And social determinant means the name of the book. Then Journal of Public Health, which is the relevance, it covers research on public health policy, parasites, and research focusing on health inequalities and access to healthcare. Then we have example article, Braveman P. and the social determinants of health. It's time to consider the causes of the causes. Public health reports. Okay. These are also journals or engines where you can gather information for your research work. Okay. And it says the relevance is that it covers research on public health. So if you have to write any research on public health, these are some of the areas that you can look into. Then we have health affairs. So when you talk about any writings or proposal in health affairs, you could look into focus on health policy and research, providing insight into healthcare access, quality, and equity. Example, Attica X and Hinton. That's two people, 2018. Beyond healthcare, the role of social determinants in promoting health and social care. So are you seeing how the topics are? Can you see how the topics are?
Yes, please. Yes, please. We
Yes,
can.
these are some of the examples how the role of social determinants in promoting health and so you realize that it was specific. He didn't say just the role of the role of social determinants but the role of social in promoting health and safety equity. It means that he has then become a secondary. He's limited the research into the area of health and safety equity. All right, are we getting an understanding of the whole thing?
Yes, please.
Okay. All right. All right. Let's proceed on. Let's look into books and book chapters. The social determinants of health, the solid facts. Okay. Relevance and reference. The relevance is to provide comprehensive overview of how social determinants affect health outcomes and disparities. This is the relevance of the research. Social determinants of health, solid facts. The relevance is that it provides. So this is the relevance of the topic. A reference will be Wilkinson R. and Mammoth M. EDS 2023. Social determinants of health, the solid facts. Okay, so it means that the topic there was chosen from this reference. Social determinants of health, the solid facts. and from the WHO. You see how information is being gathered. And we have the health inequality, an introduction to theories, concepts, and methods. Relevance and reference. Relevance explores various theories and concepts related to health inequalities, offering a theoretical framework for the research. The reference, Bartley M. 2016, Health Inequality, an introduction to theories, concepts, and methods. And so if you look at the top, it says Health Inequality, an introduction to theory, concept, and method. And look at the reference. Can you see the reference? I did not resemble, I did not the same. The reference is the same, isn't it?
Yes, please.
Amazing. Okay. Health Inequality, an introduction to theories, concepts, and methods. Polity Press. Okay. So this is how you choose your this is how you choose your topic. Okay.
Okay.
Good. Do we have any question? Any question? Do we have any questions at all?
For me,
No.
I'm okay.
Okay. Let's look at government reports and statistics, which we mentioned earlier. The ONS, which is the Office for the National Statistics. What is its relevance? It provides official statistics on health, socioeconomic factors, and healthcare access in the UK. What may be an example of it? One of the reports is the ONS 2020 Health State Life Expectancies by National Deprivation Deciles, England, 2016-2018. So these are all organizations where you can gather information from in terms of health related, and Office of the National Statistics. If you want statistics information on healthcare, this is where to resort to. Then, as we all know, popular one, NHS Digital. The NHS Digital. Its relevance that it offers data on healthcare utilization, access, and outcomes across different demographic groups. Okay.
Okay.
It offers data on healthcare utilization, access, and outcomes across different demographic groups. The example report is the NHS Digital 2019 Health Survey for England. Okay, Health Survey for England. So these are all healthcare, or various organizations or mediums where you can gather information pertaining to what you want to write about. Okay, what you want to write about or research work you want to work on. Then let's look at the NGOs. In the NGOs, we can talk about the King's Fund. The King's Fund, that's one of the NGOs. What does they do? What do? They provide research and analysis on health policy and healthcare provisions in the UK. That's what they do. The King's Fund. Tackling multiple of unhealthy risk factors. Emerging lessons from practice. Okay. So the King's Fund, all they seek to do is an NGO that seeks to enhance the analysis on health policy and healthcare provisions in the UK. And this is a particular example of a research. Example of research, which is one of the examples for the King's Fund. And the Health Foundation. The relevance of the Health Foundation is that it focuses on health improvement and healthcare quality, offering insight into health inequalities. That's the essence of the Health Foundations. It looks into insights in health inequalities. Example for it is Health Foundation 2020, Inequalities in Healthcare and Access to Services. So there are quite a lot of information out there that you can, resort to in terms of research work or proposals within the health and social care. Theses and dissertations, and then conference papers. What do you understand by thesis and dissertations? What is a thesis? What do you understand by this, please?
I'm not sure. It's a very big word.
What do you understand by that? Yeah, you got me chat him from quiet. What do you understand by that, please? Hello, Prince. Prince.
Yes, please.
I said, what's your understanding?
I think it's a formal document on how you do your research. Like,
Exactly. Thesis is just the same. Your thesis is the same. It's like before you start your project work, you need to have a topic and then a literature review. Just something few information for a supervisor to consider. Okay.
yes, please.
Okay. So yes, a minute. So we can look into the relevance of it is to offer detailed and focused research on specific aspects of socioeconomic disparities and healthcare access, providing in-depth case studies and theoretical exploration. Okay. Example, Smith J 2019, Socioeconomic Status and Healthcare Access in Urban Areas of the UK, PhD dissertation, University of Manchester. Have you seen how socioeconomic status and health care access in urban areas of the UK? That's very broad, isn't it?
Yeah, very, very broad.
Very, very broad. Socioeconomic status and healthcare access in urban areas of the UK, a PhD dissertation, University of Manchester. Huge. That's it. Conference papers, relevance, present cutting-edge research and emerging trends in public health, healthcare access, and social determinants of health. Example conference, annual public health conference by the Faculty of Public Health. Okay. Okay. Professional and practitioner journals. British Medical Journal, we know about that, the BMG. Okay, those are professional and practical journals. So these are journals that have to do more professional, just like we have NMC and JMC and all that. What are the relevance? Publishes research and commentary on clinical practice, public health, and healthcare policy. Example article, Mammoth M 2010, Fair Society, Healthy Lives, the Mammoth Review, BMG. Okay? Fair Society, Healthy Lives, the Mammoth Review, just a review journal, just a review, but you can gather information from there. Then the community practitioner as well. Relevance is the focuses on practice-based evidence and insight from community health workers and practitioners. So this journal just talk about community activities relative to healthcare practitioners and healthcare. Example is addressing health inequalities, a community practitioner's perspective. This is a perspective from an article. Okay, a perspective, just a journal. But then these are all conduits and mediums where you can gather information from in your healthcare research topic that you seek to write about. Okay. Then you have to justify for selected sources, justification. Academic journals, these sources provide peer-reviewed, high-quality research that is essential for building a credible foundation for the study. Journals like the Lancet and Journal for Public Health are renowned for their contributions to public health research. Okay, to public health research. These sources provide peer-reviewed, high-quality research that is essential for building a credible foundation for the study. Journals like the Lancet and the Journal of Public Health are renowned for contributions to public health. So we spoke about the Lancet and the Public Health. They said they are renowned. They are very solid when it comes to public health. If you want to do any research work in public health, this is where to look. Okay, books and book chapters. These are sources that offer comprehensive overviews and theoretical frameworks that are crucial for understanding the broader context of socioeconomic disparities in health. Okay. The books and the book chapters, they look more into a more socioeconomic disparities within healthcare, the socioeconomic differences within healthcare. That is one. So if you want to write anything in that regard, this is the kind of area that you need to look into. Government reports and statistics. We spoke about the NHS digital and then the Office of the National Statistics. Anything statistics, that's what you have to look into relative to only healthcare. And then the NGO reports. We spoke about the King Fund, isn't it? The King Fund that offers practical recommendation for addressing health inequalities. Then the thesis and dissertation. These sources provide detailed cases for studies and theoretical exploration that are beneficial in-depth analysis. Conference papers. These sources offer the latest research findings and emerging trends, ensuring that the study remains current and relevant. Wow. Current papers. Those are conference papers. They have to be current. Okay. You know, because those conferences are being held and discussions have gone on, you know, they feed into current issues and proposals that have been captured to solve those issues. So they are more current and emerging issues when it comes to conference papers. Professional and practitioner journals. These sources provide practice-based evidence and insights, which are more crucial for understanding real-world applications and challenges in healthcare access. Okay. All right. Are we together? By utilizing a diverse range of sources, the research project will be well supported by high quality, relevant, and comprehensive evidence, ensuring a thorough investigation into the impact of socioeconomic status in the UK in healthcare access in the UK. It means that your project, if you are able to gather information across all these engines and all these mediums, then your research work will be very, very solid and well supported. Okay. Justification for the choice of a range of sources for the research project. To ensure a thorough and comprehensive investigation into the impact of socioeconomic status on access to healthcare services in the UK, it is essential to draw from a diverse range of high-quality sources Each type of sources selected for this research provides unique value and contributing to a holistic understanding of the issue. Here is a detailed justification for the choice of emerging sources. Academic journals, we've spoken about this, haven't we? No, peer-reviewed quality, current research, depth analysis, example of sources, okay? This is when we talk about academic journals. We're looking at the peer review, current research, and the in-depth analysis, okay? Which examples are the Mammoth M and then the Brave Man P, okay? The books and the book chapters. The justification is that you are very comprehensive coverage and very theoretical frameworks, comprehensive coverage and very theoretical frameworks. Books provide a broad and detailed exploration of topics, offering a theoretical foundation and historical context that are vital for understanding complex issues such as health inequalities. Theoretical frameworks. Books often discuss various theoretical frameworks which are essential for framing the research and interpreting the findings. This is very beautiful. Theoretical frameworks. Okay? Theoretical frameworks. Example of sources are the Wilkinson R and then the Bartley M. Okay? The Wilkinson R and the Bartley M. Where social determinants of health, the solid fats, World Health Organization, and then the health inequality and introduction to theories, concepts, and methods. We've spoken about this, okay? So you have a diversity of the theory frameworks, which books often discuss various theoretical frameworks, which are essential for framing the research and interpreting findings. We say, how do we interpret the findings? We appraise them by the methodology, but the findings we gather, we interpret them. We interpret them by what? Histograms, bar charts, Venn diagrams, and those how we interpret the findings. The information that we gather, we interpret them in a way that somebody would understand. Okay? And who is that somebody? Your research should have current methodologies of data interpretation, which then your supervisor or any other person reads, they can understand by looking at those data that have been submitted, can tell them everything about their research work, because that becomes one of the core areas to display the information you have gathered in a very practical way using data. Okay? Do you have any questions? Any questions at all? Can we begin? Oh, I think he's going to work. He left his phone. Yeah, but he's already left. He's already left. Hello? Hello? Yeah, if somebody wants to get a subcontract, that's to supply more staff. It's your company. How do you have to go about it? That's staff and what's up, subcontract. You don't need that. You don't need that. What's the name of the company, please? Any questions at all? Any questions at all? These are more self-explanatory. So let's crack on. So we've spoken about the Office of Statistics, which is more of a governmental authoritative organization. Okay, so the government reports and statistics from bodies like the Office for National Statistics, the NHS. Hello, somebody saying something? Prince,
Yes, please.
are you speaking to us?
No, please. Sorry, I was at church. Sorry, I'm
Okay. Okay.
Yeah.
All right. So you can mute yourself if you're okay. All right.
Okay.
In case, yeah. All right. That's fine. So the justification for the ONS and then the NHS Digital, they are governmental organizations. Okay. They are more authoritative. They are more organizations that are government, reliable sources of data, because these are more government organizations. Okay. Then the national scope, these sources provide comprehensive data at a national level, which is critical for understanding the broader context in healthcare. Policy insights. Government reports often include policy analysis and recommendations, which are useful for understanding existing measures and identifying gaps. Okay? Policy insights. So these are all authoritative. So one was the Office of the National Statistics and NHS Digital. Okay? And then it talks about the policy insight. These government reports often include analysis and recommendations, which are useful for understanding existing measures and identifying gaps. And then examples below. Then the non-government organizations, we've spoken about that. They give practical perspectives, NGO reports such as from the King's Fund, advocacy and innovation. NGOs often advocate, don't they, for policy changes and innovating solutions, offering valuable perspective on potential interventions. Example sources: the King's Fund, 2018, tackling multiple unhealthy risk factors. Then Health Foundation, inequalities in healthcare and access to services. Okay. Thesis and dissertations. Thesis and dissertations. Thesis and dissertations. Justification, in-depth case studies. In-depth case studies. Okay. And original research. Original research. These sources often present original research and innovative approaches, contributing to unique insights to the study. In-depth case studies. Theses and dissertations provide detailed case studies and focused research on specific aspects of health disparities, offering valuable depth and specificity. Okay. All right. Then there are conference papers. Okay. So there's quite a lot. These are mostly, these are all, this topic is just trying to give you all the various organizations or sources of data that you can collect from these platforms or these organizations or search engines, or you name them. Okay, so we have the cutting edge research. Conference papers present the latest research findings and emerging trends. We spoke about that, ensuring that the study incorporates the most current knowledge and perspective. Professional networking. Conference provide, of course, conference papers provide networking among researchers or practitioners. Okay. Example conference, annual public health conference by the Faculty of Public Health. Here we have professional and practitioner journals. Justification. Practical insights. Journals such as British Medical Journal, BMG, and Community Practitioner offer practical insights and evidence from healthcare professionals, reflecting on the ground realities and challenges. Okay. Journals such as British Medical Journal and Community Practitioner offer practical insights and evidence from the healthcare professionals, reflecting on the ground realities and challenges. So this is what the practical insights do. Okay. This is what they do. Okay. They are more practical in terms of what happens on the ground and the challenges. Then you have the practice-based evidence. These sources provide practice-based evidence and case studies that are crucial for understanding how policies and interventions work in real-world settings. All right? How they work in a real-world settings. How policies work in a real-world settings. The policy that has been enacted or produced, how effective do they work when you try to implement them in the real work settings? Okay? And examples have been given. Okay? So in conclusion, we'll say that the selection of these diverse sources is justified by their ability to provide comprehensive, credible, reliable, relevant information necessary for a thorough investigation into socioeconomic disparities in healthcare access by integrating empirical evidence. So those are the ones I said, the interpretation of data. You provide those evidences by pie chart, then you can do theoretical frameworks, writing, practical insights, current research. The study will be well equipped to address the research questions and contribute to valuable knowledge to the field of health and social care. This multifaceted approach ensures that the research is robust, well-rounded, grounded in high-quality evidence from various perspectives. Okay? And below are the references that we can look into. All right? If we have any questions, let's do. If not, then we can bring the lecture to an end. It's more, please go read about it. Please read more about it so that when we meet, we can discuss. Okay? It's just a comprehensive modality, various diverging information gathering that learners or students can resource to these companies and then websites and all that to gather information, especially if you want to write a proposal within the healthcare. Okay?
Okay.
Any questions? Any question? If not, then we'll close for today then. Okay? Are we there?
Yes, we are here.
Any questions? I'm sure there's none, isn't it?
No, there's nothing.
All right. If that's the case, then we'll close to continue on next week then, right?
Yeah.
All right. Take care, Nancy. Take care. Take care, everyone.
Uh,
Daisy, take care, right?
All right.
Is
yeah,
that Daisy?
thank you.
You leave your feedbacks and then close for today. Take care. Bye-bye. Bye-bye.
Okay, bye.
Thank
All
you.
right, bye.
Thank you. Bye. Bye.